Hello. Today's date, it's May 25th of 2016. This is another video blog, yes, two in a row. I went to see the doctor this morning for my appointment, and he was happy with my blood sugar, which is averaging about 107. It was 97 this morning, so I'm getting some good numbers. He wanted me to have some tests done, which I refused. He also wanted me to, and I agreed to do it, take a cholesterol medication. My cholesterol has been high for years. Many years ago, I took a cholesterol medication. It's been over 5 years ago, longer than that. And I felt like, it took me about a month to figure out because they started me on a number of medications. I felt like every muscle in my body had been pounded by a bat. Every part of my body. There wasn't anything in my body. Maybe my eyes didn't hurt. I don't know. I thought life was not, I thought, well, this is old age. And I thought, it's not, life isn't worth living. And then I finally figured out it was that cholesterol medication, which a lot of cholesterol medications have that effect on people. And so I've been refusing to take, I stopped taking that medication, and I refused to take any more until today. I let my doctor talk me into trying this out. He gave me some samples, and he called a prescription in. And he said to try these samples, and if I have a problem with it, then don't pick up the prescription. So today I will start this. My daughter Hillary went with me to the doctor's office, and then we were going to walk over to a Chinese restaurant that has a buffet. And I love Chinese food, and I love buffets. All you can eat for X amount of money. And we started walking over, and then I got a phone call from Darlene, my ex-wife. She was screaming, "Help, help, help," and hysterical. And in the background I could hear my grown son screaming and screaming and screaming. And then she yelled something about 911, and hung up. So I called 911. Turns out she also called 911. My son has not been taking his medication. By the time we got home, the police were there, and right ahead of us, a fire engine pulled in, and then right behind us, the ambulance pulled in, and they took him to the hospital. And Hillary went down there, and she's been down there waiting at the hospital. And I just tried calling her a couple minutes ago, and she said she was in with the doctor, talking to the doctor, and she would call me back. So we don't know whether they're going to send him home, or whether they're going to keep him 72 hours, or whether they're going to keep him longer. But we live in an apartment complex, and the apartment manager was right out front of my ex-wife's apartment, which is next door to mine, and was showing some prospective people one of the apartments right across from us, when my son, who had shaved his head and was wearing shorts, not undershorts, but shorts, went running out into the yard out there, yelling and screaming and hollering and carrying on. And then he ran back in and continued his activities. Didn't hurt anybody, didn't hurt himself, Didn't hurt anybody else. He's never hurt anybody else, but he has schizophrenia. And there's, I forget what the percentage of people that I could pull up Wikipedia, but an awful lot of people have schizophrenia. It's a terrible disease. There are a lot of terrible diseases. The problem, well, there's so many problems. Schizophrenics and manic depressives and bipolar, those people just do not want to take their medication. And you can be angry with them or whatever, but just remember they have a mental illness. They're not thinking correctly, and they can't think correctly, and I just hope that someday that they can come up with a medication that they can, give to them maybe once a month that would be good for the entire month, instead of having to depend on them to take their medication every day. When my son's had these episodes in the past, I've never been able to get him to, when he decided not to take a medication, I've never been able to get him to take it. I've begged him, I've tried to bribe him, I've threatened him, everything. And Hillary has, she's been here now from Sweden 6 months. And for the last, I don't know how long, 2 months or something, she's been going over next door at 5:30 every day and getting him to take his medication and watching him take his medication. But apparently he hasn't been taking it all the time, or he's only been taking a small amount of it, or he's been spitting it out or something after she leaves. So there are a lot of problems with it. One of the problems is law enforcement and how they deal. I wasn't here this time, and luckily nothing happened, but in the past when I've had to call 911, I've always been out there waiting for the law enforcement to show up so I can tell them, he isn't violent, and he doesn't have any weapons, and then I've been able to go in and help. Then the problem is our entire fucking medical system and our health care system or whatever. Back, and I don't know what the date was, Reagan was in office, President Reagan, and the Republicans and, of course, I think the Democrats in Congress bought into it too. And the plan was to, and an injustice had been done to thousands, tremendous numbers of people. They were locked up in mental hospitals, and the keys were thrown away. There were people, there was no problem, that really had no problem. There were children who were slow or retarded, had some learning disability or something, and their parents would just dump them at the hospital. Those and other people, those people would grow up in a mental hospital, and they would grow old and they would die at the mental hospital. There was tremendous injustices. All types of things like that happened. People that had small problems that could be handled with some proper care spent their entire lives and died in mental hospitals. So I remember the discussion being carried on McNeil Lear or the News Hour or whatever it was called then, and on other shows, and there was great discussions and promises from the Reagan administration, and that these hospitals would be closed. Very few of them would remain open or did remain open, and that the people liberated from that incarceration and all the people who were suffering from that there would be health care clinics that they could go to and that they could get care, that there would be halfway houses that they could live in, that there would be counseling, and that the ones who didn't need to be institutionalized wouldn't be. A lot of discussion about it. And so what happened is they closed down almost all of those hospitals, psychiatric hospitals. And what happened was mentally ill people ended up on the streets, including veterans with post-traumatic stress and other problems, ended up on the streets, living on the streets. What also happened was you couldn't get treatment for somebody. You couldn't just say this person is whatever. And I worked hospital security for 30 years. I saw them all, people who didn't know what was going on. But when they acted bizarre or whatever they did, when the police would show up, or when the paramedics would show up, the patient would be asked, are you going to hurt yourself? No. The space aliens told me not to hurt myself. I'm here to spread joy to the world and enjoy the green sun and the purple moon and whatever they said. Didn't matter how crazy, bizarre, or what. And they'd say, are you going to hurt yourself? No. Are you going to hurt somebody else? No. And then they'd tell them, okay, go on, enjoy yourself. Families, fathers, mothers, brothers, sisters, grandparents would call, 911, and the police would respond, and the paramedics would respond, and it was the same story. I had that happen repeatedly, when my son was first diagnosed at about age 21. They'd show up and say, are you going to hurt anybody? No. Are you going to hurt yourself? No. Okay, nothing we can do. So the problem is with law enforcement responding, quite often, these people appear violent. So sometimes they are violent, but if they're really violent, if they hurt somebody or take an axe and go out and start chopping on a police car or something, okay, they may get into the hospital. Of course, they also may very well be killed by, if they have something in their hand, a cell phone or a straw or a plastic knife or whatever, the police may kill them. There may be some good law enforcement programs someplace, but I haven't seen any. I've talked to a few law enforcement people. Keep in mind again that I've dealt with this. I had to deal with psychiatric units. I worked at some hospitals where we had psychiatric units, and I saw the problems. I didn't know the gentleman. I know a young man. I didn't know him. I heard of him. He went into an open unit psychiatric unit at Trinity Lutheran Hospital in Kansas City, Missouri. A young man, very young, early 20s. He went into the psych unit, was having chest pain. He complained of chest pain, and they said, here, take this tranquilizer, or here, do this or do that. They didn't give him an EKG. They didn't do a chest x-ray or whatever. He died from a heart attack in the psych unit. They didn't pay any attention to what he said. The system is totally messed up. I don't want to see structure. The Republicans would love to see, probably now, they're sorry that Reagan removed those structures, because what the Republicans would do now is probably like to build them back the way they've built prisons, and they would make them for-profit psychiatric hospitals. And then they would scoop up everybody who, off the streets and every place else, and they would throw them in the psychiatric unit, and the corporations would make lots of money, and the corporations would donate lots and lots of money, the way the prison corporations do. Prisons, by the way, should not be run by private corporations. Shouldn't be run by for-profit corporations. The government makes the laws. The government enforces the laws. The government runs the judicial system that sentences people, that decides what's going to happen to them. The fucking prisons should be run by the government. There shouldn't be an incentive to lock people into prison. The incentive should be, what you should want to do is to get people out of prisons. I don't know what the solution is to the problem with people with mental health conditions. We need to... My son was lucky. He was put on not at first. It took about 3 tries or whatever of going into the hospital, whatever. They put him on a brand new medication at that time, which he's still supposed to be taking. This is my daughter. I'm going to end this video. Thank you very much.